Hello there, ladies and gentlemen, and welcome to Get the Facts Correct with me, Edmond Elime, alias Eddie Bobo. In today's edition, we shall be having Dr. Anjali Kumar to talk about something which is very, very important, and that is how women can get to know their fertile period. And that's we were talking about what is fertile period, how do we calculate the fertile period, and why do we, our women, need to know their fertile period. And we will have some more questions to ask a doctor as we go up with the program. Hello, Dr. Anjali. Welcome on board.
Millions of women across the world struggle to get pregnant. Millions of women struggle with irregular periods, PCOD, hormonal issues. So knowing your fertile period can actually help you to plan your pregnancy more accurately. And when you're actually not planning a pregnancy, then also knowing your fertile period can actually help you to prevent that pregnancy which is unplanned and unwanted. So what is a fertile period? So fertile period is that period of the menstrual cycle when your chances of getting pregnant are the maximum. So to understand this, let's go to few basics. The length of the menstrual cycle typically is 28 to 30 days in most of the cases, though it can vary from 22 to 35 days. Now we calculate the length of the menstrual cycle starting from the first day of the period. Remember, the first day of the period is the day when your bleeding starts. So ovulation, the process wherein the mature egg is released from one of the ovaries, typically happens 14 days before the next period. Means the period which is about to come, the ovulation happens 14 days before that. So which means that if you have a cycle of 28 days, the ovulation will now happen on 14th day. Now typically once the egg is released, the life of the egg is about 2 days, which means it is fertilizable up to 2 days. And after the intercourse, when the sperms are released inside, they can stay alive for almost up to 5 days. So which means 2 or 3 days before the ovulation date and 2 or 3 days after the ovulation date is the time which is the fertile period. So in a 28-day cycle, the ovulation happens on day 14 and the fertile period would be from day 12 to day 16. Now in a 32-day cycle, the ovulation will happen on day 18. So the fertile period will be from day 16 to day 20. Now in a woman whose cycle is 40 days, her ovulation is happening on day 26. So the fertile period would be from day 24 to day 28. Now this kind of a calculation will work only if someone has regular length of a cycle.
Thank you very much, Dr. Anjali. And we know that some women have irregular cycles. Is this the same way they will, or the same procedure or the strategy they will use to calculate their cycle or their menstrual cycle, or to look at their menstrual cycle to be able to determine their fertile period? Would they use the same way that people or the women who have regular cycle use to be able to determine their fertile period?
For someone who has irregular cycles or PCOD or some kind of a hormonal issue, this kind of a calculation obviously will not work. Also, you need to understand for someone with a regular menstrual cycle also, sometimes because of a lot of reasons like stress, worry and anxiety, the date of ovulation could become preponed or postponed.
Thank you very much for making that one very clear. And we should also look at the signs and symptoms. You might want to highlight some of the signs and symptoms because we will have some people who do not have idea of what, for example, basal temperature is, for them to be able to use that to determine their fertile period. What are the signs and symptoms of fertile period? What would a woman find different on their body to be able to know that they are approaching the fertile period, doctor?
Some signs and symptoms which you yourself can observe in your body, which can help you to predict your ovulation and obviously your fertile period. So number one is what is known as a basal body temperature. So if you take your basal body temperature, which means the body temperature as soon as you wake up, while you are still in the bed, you've not eaten anything, you've not drunk anything, you have not talked to anyone. So that is the time if we take your temperature and continue taking that record, it can help us to predict the ovulation. And just before the ovulation, it immediately picks up and continues to be higher till you get your period. And this rise in the temperature could be just about 0.5 to 1 degree Celsius. And if you are careful, or maybe if you're carefully monitoring that temperature, it can actually help you to predict the ovulation. Nowadays, we have specially designed thermometers which are available to calculate this. So the second thing which can actually help you to predict your ovulation and hence your fertile period is the position of the cervix. So what is cervix? Cervix is the mouth of uterus. So in the first half of the cycle, the cervix is very firm, it is closed and it is sort of hidden behind. Just before the ovulation, now the cervix becomes soft, it opens up and slightly comes a little forward and upwards. So this actually happens to facilitate the entry of the sperm into the uterus. Then the third thing which can be done to predict the ovulation is the cervical mucus. So if you remember, in the last video we spoke about the types of vaginal discharges. Vaginal discharge is nothing but the discharge which comes from the cervix and vaginal glands. So just after the periods, the cervical mucus actually is very scanty. And as you move towards the ovulation, now the cervical mucus actually becomes very thin and watery and becomes very copious in amount. Just before the ovulation, it could be very thin, very watery, almost to the consistency of the egg white, which means if you take it into your finger and if you stretch it like this, you can actually stretch it up to almost 8 to 10 centimeters. There are some other changes also which, if you are attentive, you can find them out, which can help you predict your ovulation. Many women actually complain of little pain in the lower abdomen. This is actually called Mittelsmers. It's a German name which means middle pain. Just before the ovulation, there could be little heaviness in the breast. The breast could become actually little tender. Just before the ovulation, the woman's sense of smell also becomes very strong. Her sex drive also becomes little more. There could be little swelling at the vagina and vulva also. Other than this, of course, nowadays we have fancy methods also by which we can calculate your ovulation date. We can do ultrasound examination. This is known as follicular study or the ovulation study. We have now fancy apps also, wherein you can put in your period cycle length or the period date, and these apps can actually help you to calculate your ovulation date and the fertile period. But somehow I always feel being attentive to your body and being in tune with your body can actually help you pick up these signs which can be very accurate. So I always feel that pregnancy should happen by choice. It should never happen by chance. So being attentive to and being aware of your body will help you plan your pregnancy when you actually want to.
Okay, ladies and gentlemen, that was it today. Thank you very much, Dr. Angeli, for having given us that very important information. It's a very rich video, and we expect people to watch it and learn something, because we know there are a lot of couples out there who are struggling with fertility. So it is very important that they listen to this video and get the facts correct. And so, ladies and gentlemen, that was it today in Get the Facts Correct with me, Edmond Elime alias Edibobo from Edibo Studio. Until some other time. Ciao.